There has been a concern over the overuse of antibiotics. So there has been concerns regarding antimicrobial resistance also. So what is this antimicrobial resistance? Basically, this is a natural process where the organisms which are present in our body, once when they are under the exposure of antibiotics and antimicrobial medicines time and over again, so they become drug resistance. They change their structure over time and they adapt to those medicines, and this whole process is known as antimicrobial resistance. So this is a serious concern. As you can see, our ex-AIMS director Dr. Randeep mentioned that AMR is a ticking time bomb, and without robust policies and international collaboration, the consequences can be catastrophic. So, what are the reasons for rising AMR in India? So, one of the reasons is misuse of antibiotics. So, our WHO report also tells us that antibiotics are very oftenly used for preventive causes, even when the actual disease or the actual I'm sorry, even when the actual disease has not happened, and there is still a scope that other medicines or very less amount of antibiotic can help, but still in those cases also we are using overdose of antibiotics. Then second reason is over the counter sale. So unlike in countries like USA and various developed countries in Europe, you cannot get antibiotics from any medicine shop without a doctor prescription. But in India, you can go to any pharmacy and there you can just buy your own, go and buy any antibiotic drug or any antibiotic tablet, and you won't need a doctor's certified prescription. So the ease of availability and the over the counter sale is also a reason for rising AMR. Then also a major reason is use in livestock sector. So the same antibiotics which are used for human are used in the livestock sector, and from that livestock sector it enters into the food chain, and it is ultimately then consumed by humans, and this keep on increasing, this AMR keep on rising. Then there is this attitudinal or awareness issue of self mediation, that for example you might have also witnessed in your home own house, for just very minor viral infections or very minor cold and cough, people very often take that paracetamol, citrazine. So citrazine is not for such mild cough and cold or mild sneezing or uh, such mild viral issues, but still people takes consume that tablet by their own. And there was also a report that 50% of this type of medicines like citrazine is used for preventive cause. The actual fever has not yet happened, but before it, only to prevent that thing, the antibiotics are being used. Then poor sanitation is also one of the issues. Then we have poor health infrastructure, we lack surveillance lab. Then globalization. So globalization has led to increase in the tourism, and with spread of the tourism, the spread of AMR has also been witnessed. People from different parts of the world can now easily access easily access and easily move to different countries, and this has led to increase of AMR. Then there is also promotion by unfair means of antibiotics by companies. For example, we had us last to last year we had various articles regarding the malpractices done by paracetamol and Dolo 365. They were giving some sort of commissions to the doctors to prescribe that medicine. So this has been also one of the major causes. Then what are the impacts? So impacts is we might reach pre-penicillin era. What is pre-penicillin era? So penicillin was one of the antibiotics, and before that era, any disease which came was almost like a pandemic. So if we keep on using so much of antibiotics, we might reach a level where the antibiotics would stop working, and once that happened, then it will amount to be a catastrophic pandemic. Then another impact is, as stated in the WHO report, there could be 10 million deaths by 2050 if the trend goes on like this only. There would be around 1.1 to 3.8% loss in global GDP. Then life expectancy would decrease by 1.8 years by 2035 to be very precise, but you can write by 2030s 40s. So there would be a decrease in life expectancy around 1.8 years, and by 2050 there would be economic losses of $100 trillion globally. This is WHO data. By 2050 economic losses will be 100 trillion globally. Then there is also vulnerability to dysobiosis. So dysobiosis is a condition where our good and healthy gut bacteria get severely impacted due to these antibiotics, and which can further cause various disorders in our metabolic systems. Then the next is health cost will increase because the low grade or the cheaper antibiotics will stop working, and the new antibiotics which will come at that time, which might be effective to some extent, would be very high cost. So the health cost would increase, and as it is said in India that you are just one majority of the Indians are just one health accident away from poverty. So when this health cost will increase, it will drive more people to poverty. Then another impact is neonatal deaths in India. It is around 58,000. So that's a high number. Now what are the measures which are taken by government and which are taken globally? So first we'll see the global measures. So globally we have a global action plan on antimicrobial resistance. This plan is by WHO. The focus here is improving the awareness about the use of antimicrobial medicines. Then the surveillance is strengthening. So the WHO is focusing on the members to provide better surveillance and strengthen surveillance to capture the misuse of AMR. Then they are also focusing in on reducing infections. Then there is another initiative of that is known as Global Antimicrobial Resistance and Use Surveillance System. Then another WHO's initiative is the One Health approach. So before talking about the One Health approach, this global antimicrobial resistance and use surveillance system, this is also basically focusing more on enhancing the surveillance and the use of the antimicrobial drugs, and it is trying to prohibit the misuse or the over exaggerated use of AMR. Then WHO's One Health approach is basically focusing on a comprehensive antimicrobial resistance dealing. How it is all because how so it will include livestock, environment, and it will focus on the food chains. So as you have seen, antibiotics are not only coming through direct usage of the medicines, but they can also come through the livestock products like the milk or the non-veg products which many of the people consumes. It can come through the food chain. So the WHO One Health approach focuses on these factors also. Then on national level we have National Action Plan on Antimicrobial Resistance. We also have Antimicrobial Resistance Surveillance Network, which is managed by ICMR. So this has also aspects of surveillance, strengthening surveillance, because this is a um, then the next is FSSAI regulation. So what they have done is, in the non-vegetarian food, the regulations have prohibited the use of antimicrobials. Then next is integrated surveillance program. This is also focusing on surveillance. Then the government is also focusing on the awareness campaigns, increasing awareness campaigns, and we are also trying to improve sanitations. Uh, this by, we can say, by Swachh Bharat Abhiyan or clean city missions, and there are various other initiatives. So this was about AMR.